We're going to begin the thoracic and CV assessment. We're going to begin by saying that there is no external evidence of thoracic abnormalities. The thorax appears symmetric and in a relaxed position. We are going to start by palpating the posterior chest. I'm going to start, I'm going to put my hand at the bottom of the rib cage, right along here. I'm going to pinch up some skin. I want you to take a deep breath for me. Okay, and as you can tell, that both sides of the chest expanded equally, so the chest appears to be symmetric. Okay, now we are going to percuss the posterior chest wall bilaterally. We are going to start at the top. All lung fields appear to exhibit proper resonance and no dullness. We're now going to auscultate the same areas. Posteriorly. Just take deep breaths for me. Okay, now we're going to do lateral. I need you to face the wall. Let me start with your left side. Okay. Okay, face me, but I'm going to flip and do this lateral side as well. Okay. Lung sounds appear clear with no crackles or wheezing throughout in all areas, anterior, posterior, and lateral. Okay, now we are going to work on the CV assessment. We have noted that there's no pulsations or abnormalities with the CV assessment. We're first going to auscultate for heart sounds with the diaphragm and bell of the stethoscope. And I begin by telling my patient that it's going to take me longer than normal to do this assessment because I have to really focus on each sound within the heart. So don't be alarmed if it takes longer than you think it should. You can just breathe in a normal fashion. Okay, there appears to be normal rhythm with a clear S1, S2 sound and a heart rate of 82. I'm now going to go through the same steps listening with the bell. Okay, same findings with the bell. Okay, now we are going to palpate the radial pulses bilaterally to make sure they are equally strong. And there appears to be a 2+ quality on both. let's see, I guess just put your leg up here. We're going to do the posterior tibial pulse bilaterally. And I can feel a 2+ normally strong pulse on both of these. We're going to do a dorsalis pedis pulse. Which is a 2+ bilaterally as well. Alright. Now we're going to just change to the abdominal assessment. Just look there. Alright, we're going to raise your shirt up just so I can see your abdomen. Okay. We're going to start by inspecting the abdomen. The abdomen appears flat and have a symmetrical contour. I don't see any lesions or scarring. We are going to also auscultate for bowel sounds in all 4 quadrants. I'm hearing normal active bowel sounds so far. Yes, normal active bowel sounds can be identified immediately as soon as the stethoscope touches the abdomen. Okay, now we are going to percuss all 4 quadrants just to check for appropriate tympany. Okay, appropriate tympany noted. Okay, we are going to do light palpation, in all 4 quadrants. We're going to see if we can determine any masses or tenderness throughout the abdomen. We're going to start in the right lower quadrant. I'm just going to use all 4 fingers and press in about 1 centimeter. Okay, no tenderness or enlargement noted so far. Now we're going to switch to a deep palpation, which is about 5 to 8 centimeters deep. Feel the edge of the liver here. So far, no enlargement. Don't feel any masses, or I'm assuming tenderness. We haven't heard any complaints from our patient yet. Okay, and that concludes our assessment.